Good morning to all. Sorry.
Yeah, go.
Yeah. So good morning to all. Thank you, Dr. Prashant, for inviting me for this talk. In the next 10 minutes, we will be talking about ultra-wide field multicolor imaging. Dream Big is what I've named it. You will come to know why I've named it Dream Big. So multicolor imaging is different from conventional photography because conventional photography uses light to take images, whereas multicolor images uses three lasers, namely the blue, green, and red laser, to take individual images and merge it to form a composite image, and that's why we call it a multicolor image. This is a multicolor image of three different machines. By far I feel Mirante gives the best pseudo color which almost resembles the normal color of the fundus. So this is a comparison on the left hand side of a multicolor, a color image from fundus photography when compared to a multicolor image of a patient with epiretinal membrane and significant cataract. You can see the clarity of the image and the sharpness and the contrast unparalleled in a multicolor image when compared to a normal color fundus photography. So why visualize ultra-wide field? Peripheral retina is the site for pathology in many retinal diseases like diabetic retinopathy, vein occlusions, uveitis, vasculitis, and rheumatous retinal detachment. As Dr. Prashant rightly mentioned, the conventional photography only gives us around 45-degree viewing angle of the fundus, whereas an ultra-wide field gives almost 200-degree. Mirante offers you almost 163 degree of fundus imaging in a single click. Ultra-wide field means any field which is beyond 100 degree, we call it ultra-wide field. And studies have also shown that ultra-wide field is superior to clinical examination detecting NVE in peripheral fundus of diabetic retinopathy. Protocol AA told us that predominant peripheral lesions were seen more clearly in ultra-wide field imaging, but it was not a predictor for two-step worsening of diabetic retinopathy, which a wide field fluorescent angiography was. I would like to concise my talk into DREAM, that is 5 important points where a multicolor imaging scores over conventional imaging in retinal diseases. To document, to reveal subtle findings, to educate the patient as well as your residents, to analyze a situation where you are in the crossroad, where you don't know where to make a decision, and also monitor progression as well as response to treatment. How do you interpret a multicolor image? So this is the multicolor image of an epiretinal membrane. So here you have an epiretinal membrane, and here you have a schisis of the macula. So it is imperative to preoperatively plan to how to remove this epiretinal membrane atraumatically, because any further trauma to this area may have a visual deterioration. So the blue part of the image clearly shows the epiretinal membrane, and the schitic part is more clearly seen in the green reflectance image along with the blood vessels because it is intraretinal, and the red image shows details of the retinal pigment epithelium. So multicolor imaging helps us in preoperative planning in dissection of membranes. So this is a case of a multicolor image, a wide field image of a multifocal CSR. You see areas of subretinal fibrin with a central dark area which corresponds to area of leak. A superimposed wide field angiogram clearly shows the areas of leaks were corresponding to those dark areas. So in patients where you're unable to do a fundus fluorescent angiogram, this may act as a surrogate marker to do laser to these areas. This patient had multifocal CSR with exudative retinal detachment. Multicolor wide field imaging may be a good documentation tool and an education tool many a times. This case of macula on retinal detachment, I was able to explain with the help of a wide field image to this patient why his vision is still good and you have a serious problem in his eye, and also able to teach my residents on how a horseshoe tail looks like and what are the signs of retinal detachment. It is of paramount importance in pediatric retinal diseases. ROP, as we know, the parents are very skeptical. You need to show them how the response is to treatment and what the disease entity is. And also in cases of FEVR, which is an ever smoldering disease, we need to find out areas of activity, subtle areas of activity, and start treating. For all this, wide field multicolor imaging is useful. Yet another area where scores over conventional imaging in subtle cases of vasculitis. As in this case, we might brand it as normal. I had a suspicion of vasculitis. The blue reflectance image clearly shows the areas of vasculitis in the periphery much more clearly. In patients where you have a myotic pupil, as this patient had a sudden loss of vision, I could hardly see the disc with indirect ophthalmoscopy. An ultra-wide field fundus imaging told me a whole lot of information. The patient had a massive RP, a rip with an exudative retinal detachment. The other eye had a similar finding as well. It is also helpful in monitoring optic disc edema. Again, the blue reflectance image shows a peripapillary whitening which slowly goes off as the edema subsides. So monitoring disc edema, also multicolor images do carry a role. Peripheral exudative hemorrhagic chorioretinopathy. This patient had a large peripheral hemorrhagic retinal pigment epithelial detachment which subsided on anti-VEGF therapy. It is cumbersome to note every subtle findings on every visit on the file. By taking ultra-wide field fundus images, we are able to see that, monitor the progress of the disease and also response to treatment. Patient had subretinal hemorrhage with collapse of the PED with anti-VEGF therapy, and you can see that the hemorrhage is slowly subsiding, and probably a decision can be made on cessation of therapy or to have a close follow-up on this patient. We know fundus fluorescent angiography might help in this situation, but you cannot keep doing fundus fluorescent angiography every time you have a doubt. So many times, wide field color fundus imaging comes to the rescue, but it cannot replace wide field fundus fluorescent angiography. This is another interesting case where we gave intravitreal injection for this diabetic macular edema patient 2 months back. 2 months later, he presents with sudden decrease in vision. You can see a massive choroidal detachment. You can see the ora serrata so clearly in this. Such a beautiful image though, not so good for the patient. Supranasally, I could see areas of subretinal fibrin with exudation. So patient had acute renal failure with fluid overload and exudation throughout the body. Had a puffy face and puffy leg along with similar effusion in the eye. All we had to do is closely observe this patient. As the symptoms of acute renal failure subsided, so did the choroidal detachment and the subretinal fluid. So it is extremely useful in monitoring cases and all to analyze cases when you are at the crossroads and don't know what to make a decision on. Peripheral retinal tumors, an excellent tool to monitor its progression and regresses following therapy. This secondary had a good resolution following chemotherapy. Vasculitis monitoring again is extremely important. This gentleman I followed up for almost 3 years. He was an oncologist by profession. Subtle areas of reactivation was picked up very well on serial wide field imaging, and I could prevent something which he had in the other eye because of using wide field multicolor. I mean, the other eye had a vascular occlusion by which he had lost vision. So I could prevent by closely following up with wide field imaging to prevent this vasculitis. As a matter of fact, I could reinitiate treatment. I could add a second immunosuppressive agent, but I definitely prevented this from happening. So close follow-up, diagnosing or picking up subtle changes are extremely useful in cases of vasculitis when you do a multicolor wide field imaging. Disadvantage of MCI is slightly long fixation period, artifacts like ghost images and lashes, color distortions, and a map effect of wide field imaging is always there, but the advantages do outscore the disadvantages as unsurpassed sharpness, contrast, and clarity to the images. A combined platform with OCT angio, and FFA and ICG helps us, and it becomes time efficient many a times, and the non-mydriatic property is a potential screening and documentation tool. Thank you very much for your patient list.
Great presentation, Cheriyan. Especially when you pointed out the small pupil we get so many situations which children walk into the clinic, they are very uncooperative with an indirect ophthalmoscopy, and you put them on and take a picture, and in these cases, even if you go to the IR image, don't even go for the color image, the IR image, there's no light coming out, and you're able to document the entire fundus. So it's extremely useful in these cases to do it.
So is the patient which has got a lot of photophobia and post-operatively the eye is all congested and ballooned up, unable to see. Those instances also, as sir said, get beautiful images.
Yeah.
Thank you.
And before I move on to the next presenter, only it's not the disadvantage, I would just correct the word which Shen used for it. It is a limitation of the system at this point of time. It's a pseudocolors which we are using in this technology. So it's near normal color, that is the thing. And few of the disadvantage, rather I would label it as limitations. Yeah.